The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, everyone. Welcome. We're gathered here for the next episode of TMD Demystified. My name is Tony Urbanek. Today's episode, which is, in my world, always done on a Tuesday, usually Tuesday morning, is entitled, "The Truth About TMD Causes Social, Academic, Educational, and Healthcare Delivery Disruption." Using the euphemism, let that sink in, but it's true. This is not going to be a relatively long, I hope it's not going to be a relatively long episode. I have a single point to make, and then I'll back it up with logic and experience and knowledge. But the truth, and then we'll define what truth is. Truth about TMD, we'll define what truth about TMD is, causes social, academic, educational, and healthcare delivery disruption. What I discovered, fortunately or unfortunately for me, was the real pathophysiologic mechanism, without using the word pathophysiologic, because if you're public watching this, you don't know what that means. If you're a doctor watching this, you do, but it just means the mechanism, the real mechanism that creates all of the TMD symptoms. Temporomandibular Joint Disorder. There is only one disorder. It's not a series of disorders. There's a series of symptoms. Absolutely. There is a series of symptoms, but there is only one disorder, temporomandibular joint disorder, and the disorder is created by the cause of all the symptoms. That's the disorder. I can't make it clearer, and I can't make it more logically correct. And the opposite of that is illogical and not correct and not based on science. But what has been done, what has been used, what has been taught, what has been applied to patients by various kinds of healthcare providers for the past 70 years has at the very best attempted to treat symptoms. Essentially, there's nothing illegal or immoral about treating symptoms, but the point is, if you can figure out the cause and treat the cause, you don't need to treat the symptoms, because the symptoms will not arrive or they'll dissipate if you treat the cause. I mean, one example, look, if you have an infection coming from a hot appendix, I'm a surgeon, so, a hot appendix creates a temperature, increased temperature, you got an infection in the body. So you can take some aspirin or you can take some ibuprofen to decrease the inflammation or decrease the temperature. They work in different ways. But all you're doing is treating the symptom. You got to treat the cause. Take out the hot appendix. Does that make sense to everybody? All right. So what I discovered was something very simple, and we'll talk about that again. I have described it in any way, every way, shape, or form I possibly could, but the point I'm making today is the truth about TMD creates the social, academic, educational, and healthcare delivery disruption. What I discovered, what I use, what I teach, what I promote to patients and doctors has changed the paradigm of how to treat this thing called temporomandibular joint disorder. And the fact, and here's where we're going with this, the pushback that I have received so far has been obvious. I would not call it tremendous because I'm still here. If it was tremendous, I might not be here. And we'll give you an example of that in a moment. But I have directly, personally received a lot of pushback that has been more, rather than being overt, it has been covert. In other words, they don't really want to tell me who and where and why it's coming back. It's been more covert than overt, but some of it has been very covert. And I am not going to give you the examples to try to embarrass any organization or person. I could, but I'm not gonna, which would just be my attempt to embarrass them, which is I don't need to do. But what I am saying is that I have received a lot of pushback on the issue, and that's why I know that I'm over the target, because if I wasn't over the target, I wouldn't be getting so much pushback from organizations and individuals. So a good example, I mean, and what I discovered, which I didn't discover anything. It's in the literature. It's the orthopedic surgeons know all about this. This is a temporomandibular joint is a joint. First of all, it's a joint. And who treats the joints of the body primarily, and who does a really good job? I have great affinity for my orthopedic colleagues. They have done a tremendous job of studying and treating and learning how to treat different joints in the body in various ways, surgically and non-surgically, to a high level of standard and a high level of success over the past 50 years. Since I have been an oral and maxillofacial surgeon, I have been in the trenches with my orthopedic colleagues, sometimes in the operating room with them. Brings up a funny story, very brief. I'm at the head of a facial crunch at the head of the operating table, and I have a colleague working on a badly damaged lower leg, badly damaged. And as I'm trying to do very precise motions and surgical procedures on the facial skeleton with the face all wide open and, you know, the blood and all this stuff going on, I'm having to deal with my orthopedic colleagues who, because it was such a big crunch and we wanted to get the patient back into some semblance of order, he's pulling on the lower leg, and the whole body is like vibrating and pulling out of my range of motion almost. I mean, and I remember that very well. But I have very very strong affinity for my orthopedic colleagues because they know what they're doing. Unfortunately, the dental community doesn't know what it's doing about treating TMD, but it's been in the literature, and if they have followed the lead or allowed or had the orthopedic doctors take a look at this and use and apply their information to treating the TMD, this TMD problem would have been solved 50 years ago. It just took someone like myself, could have been anybody, but like myself, who had a broad background in both dentistry and medicine and academics, with a little knowledge of cell biology and gross anatomy. Unfortunately or fortunately, I have a degree in that, cell biology and anatomy. And that broad base of knowledge and being pointed in the right direction by my patients once I decided that surgery was not going to be the answer for the long-term answer for temporomandibular joint problems, and did the research with the direction of patients who said, look here, this is what I know about this. Half a dozen patients says, if I put my finger and my tongue between my front teeth, it feels better. That led me to do an investigation of what happens when you put something between your front teeth, which led me to the literature and the textbooks and the knowledge that my orthopedic surgeon friends have and have currently and in the past that showed and proved that if you treat the inflammation directly by unloading the joint, like a set of crutches unloads a damaged, inflamed knee, all the symptoms of TMD diminish and go away over a relatively short period of time. And the disparate symptoms, again, I will repeat, the disparate symptoms of temporomandibular joint disorder, single disorder, caused by chronic inflammation within the temporomandibular joint are frequent and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ear, feeling of fullness in the ear, that's called subjective hearing loss, vertigo, dizziness, upper back and shoulder pain and tightness, which is extremely common, arm, hand, finger tingling and numbness, and various kinds of jaw locking. If the orthopedic surgeons hadn't given this joint away to the dentist, because the orthopedic surgeons were afraid of treating this joint because it was attached to the jaw, which is attached to teeth. So they figured it must be a dental problem. And oh my God, what happened after that was not good, terrible, because it went in the wrong direction. Dental schools, all dental schools at the current 2026 level of knowledge in the dental schools teach this joint is different than any other joint in the body. It's not different than any other joint in the body. It operates pathophysiologically. It operates the mechanisms of this joint, not the look of the joint itself. It has a different aspect to it. It's much smaller than most joints of the body, but not smaller than the joints of the hand or the wrist. It has a little different viewpoint of the joint. It has two separate motions, both a rotation and a translation at the same time. And you have two sides, two joints attached to the same bone. So you can go back and forth, forward and back multiple, but that doesn't make it a different joint. That doesn't make it unique from any other joint in the body. The pathophysiologic, neurologic, endocrinology differences are none. This joint operates like any other joint in the body when it comes to all those other features and systems in the body. So when you come across something that is already there in the literature, you can't take credit that I discovered it. I just read it and connected the dots. Now that I have done that and proven after 15 years and treating personally well over 5,000 patients successfully, and now having doctors throughout the United States learning how to do this. We currently have doctors, dentists in 18 states and growing. I think we just added one state who use a very simple device and protocol that unloads the joint. It's a device and protocol. It's a tool to use. This is a tool. This isn't a widget. Certainly not something you can get at Walmart or Walgreens. Comes in two varieties. The original one had little wires on it to hold it in place, and the current one is CAD/CAM created on a computer and 3D printed and then finished off by a human being. But the point is, it's a protocol that you have to use a tool on, and if you use the tool correctly, you'll get the response because you're making the inflammation in the joint decrease. And inflammation creates each and every one of those symptoms. That is what has already been in the literature. That is already in peer-reviewed literature, how the autonomic nervous system creates muscles to become tight and contracted. They pull on the bone and create the pain. And then something called the petrotympanic fissure, which is in Gray's Anatomy, and discovered in 1680. The petrotympanic fissure, the fissure that allows inflammation from the joint into the middle ear, was actually documented and discovered by a Swiss anatomist in 1680 by the name of Glassier. That's a long time ago, but it's been in the literature. Nobody bothered to connect the dots. Nobody bothered to know enough or read enough where they could figure this out. Now that it has been figured out and the pushback is substantial, I have to live with that. And I can say with experience that first, they ignore you, then they laugh at you, then they fight you, and then you win. And that statement has been attributed to Mahatma Gandhi. I'm not sure that he is the original one who came up with that, but it has been attributed. And if you look it up, if you AI it or look it up on the internet, you will find it's attributed to Mahatma Gandhi, who actually was the primary force of getting country of India established and out from under the control of the British Empire 100 and some years ago. First they ignore you, then they laugh at you, then they fight you, and then you win. And that is what I expect to happen. That is exactly what I expect to happen. But when you change a paradigm, of treatment, and it is so disruptive because, again, to go back to who's doing the pushback is being done by people and organizations who have something to lose by changing the paradigm. And currently, to this very day, most of the attempted treatment for TMD disorder, which they call disorders, multiple disorders, are done by physicians with drugs and physical therapists with different varieties of mechanisms, and especially dry needling. The drugs are numerous, and they not only prescribed by physicians, PCPs, and neurologists, but they're prescribed by dentists and oral and maxillofacial surgeons. All of the drugs are designed to do nothing more and nothing less than suppress the nervous system in multiple ways, depending on what the drugs are. And the only effective drug is a drug that will decrease inflammation. The problem is the drugs that decrease inflammation, like ibuprofen, brand name Motrin, are only effective for a short period of time, and then they run out of steam. There are stronger drugs that are anti-inflammatory, and as you increase the level strongness of the drug, you increase the side effects, which can be tremendously toxic on the body. So anti-inflammatories, if there was a good anti-inflammatory that really worked over a long period of time, over years, over decades, that's all you'd have to do. But you can't do that because they run out of steam or they become so toxic that the side effects, the patients can't stand them. And that's just part of it. And then you have surgeons like myself who for almost a couple decades really tried to come up with a solution for temporomandibular joint disorder. Surgically. I was one of them until I finally decided that I couldn't face my patients and be honest and say, I'm going to fix you, knowing that a third of my patients would be back within a year or two with the same symptoms. And then they're into these multidisciplinary programs where they bring in psychologists and psychiatrists to try to talk the patient into not clenching and grinding. In my mind, that's silly because we don't even understand the mechanism for clenching and grinding. We don't. No one claims they do. The only thing we know about clenching and grinding, better known as bruxism, is it's related to stress. And everyone on this planet has stress. There isn't anybody on this planet who is not stressed. Now, some people deal with it better than others. This is true. And not everybody that has stress certainly has bruxism, and not everybody who has bruxism has TMD. However, trying to talk somebody by psychiatric talk therapy to quit bruxing their teeth and to get rid of their stress is impossible. But they try, and they do that along with all kind of other things, including machines and myofunctional treatment and all kind of diagnostic tools that don't prove anything other than the symptoms, and then try to treat the symptoms. So when you have a solution, which is quite simple, using a simple tool and protocol, it's got to be used correctly. If you have a hammer or a tool of any kind, a screwdriver, and hold the tool from the wrong end, you're never going to get it to work correctly. So there have been many examples. There have been many examples of this occurring in our culture, in our world culture. I write a blog every week, which anyone is welcome to read. Every week I write an article on our blog, which is published in multiple places, but published on the website, which is www.urbanektmj.com. But this week's blog has the same title as we have on today's podcast, The Truth About TMD Causes Social, Academic, Educational, and Healthcare Delivery Disruption. And one of the biggest disruptors that I could think of offhanded in the world occurred about 150, 200 years, well, more than that, 16, 17, 18, 19, actually 300 years ago, named Galileo. And when I Googled that, I said, how was Galileo handled? How was Galileo handled when he proclaimed that the Earth is not the center of the universe, universe-centric, and he proclaimed that the sun does not revolve around the Earth as the Earth center of the universe 300 years ago, but he proclaimed that the Earth revolved around the sun. And that gentleman's name was Galileo. And I Googled what occurred with Galileo when he went against the grain, when he found something that was obviously true to him and proclaimed it. Well, what happened to Galileo according to AI? I will not plagiarize, that's where this came from. He was tried for heresy in 1633 after Galileo published his dialogue concerning the two chief world systems. In 1632, which promoted the heliocentric, the Earth being the center of the universe, he was summoned to Rome. The Inquisition found him vehemently suspect of heresy. I guess I'm suspect of heresy by proclaiming there's only one cause for TMD, which is chronic inflammation, and there's not a multiple series of problems, of diseases. It's only one disease, chronic inflammation in the joint. All right, so he promoted the model, a heliocentric model. He was summoned to Rome. The Inquisition found him vehemently suspect of heresy. The sentence and recantation part of this, to avoid potential torture and death. I don't think that I will be tortured. I'm still here. I'm not even worried about being tortured or death. Galileo was forced to publicly abjure, curse, and detest his findings. He was sentenced to indefinite imprisonment, which was immediately commuted to permanent house arrest, which he served for the rest of his life. That hasn't happened yet to me. I don't expect it to happen to me. But I can tell you, I have had one of my oral surgery colleagues who is vested heavily in doing temporomandibular joint surgery and is in very powerful position within my particular specialty of oral and maxillofacial surgery, who literally gritted his teeth and growled. It was a growl and a grit when he informed me what a low dog I was and that I had nothing valuable to say about temporomandibular joint problems. And there have been many others as I've talked about this and allowed people to make their own judgment on the facts that I bring to their attention. And it won't be the last. So first they ignore you, then they laugh at you, then they fight you, and then you win. All right, I have made my point. I've gone on long enough. I look forward to the next time that you visit this podcast. Our next episode, it will be brought to your attention on a Tuesday. It's always my day to do the podcast. If you'd like to talk to me, if you'd like to criticize, if you would like to laugh at me, I'm available at tony@tmjservices.net. If you are a doctor, a dentist in particular, really the target is oral surgeons, general dentists, and orthodontists who are in excellent position to learn how to do this and to treat TMD in their own geographic area, in their own neighborhood, in their own city, their own town, their own state. You can find all about it at www.urbanektmj.com. You can begin to take the online course, which is very short and very easy to teach you the nuances of using a simple device, tool, and protocol that decreases the inflammation within the joint so that the symptoms, the disparate symptoms of TMD diminish and go away. With that said, I look forward to the next time that you drop in to this podcast. I am Tony Urbanek, and this is TMD Demystified.